I finally saw the doctor. I got to see the baby.
What's up, fertility fam? Let's get these babies, ladies.
What's up, fertility fam? How are you? Oh my God, time is flying by. I finally saw the doctor. Doctor, hi, do you need something? No, oh my goodness, no. Okay, you girls, let's you guys go play. Mommy's gonna talk to the fam. So, I saw my maternal fetal medicine doctor. I know some of you guys had questions in the comments. A maternal fetal medicine doctor is also called a high-risk doctor, high-risk OB, high-risk obstetrician. They are obstetricians by trade, and they've done additional training to become a maternal fetal medicine doctor. I am only going to be seeing a maternal fetal medicine doctor. My schedule is super busy. I don't have time to see 2 different doctors. And so, yeah, she's gonna deliver me. She will deliver. We'll get into all that because I had questions for her. Before I saw the doctor though, so I saw the doctor when I was in week 13 of my pregnancy. As I'm recording this, I'm currently in week 14. I saw her the week 13, and the week 12 I went in before for a Nuchal Translucency scan. Basically, they're looking for trisomies, right? 21, 18, and 16. So Down syndrome, Turner syndrome, Edwards syndrome. I might have flip-flopped those, but you get what I'm saying. Where there's a 3rd chromosome present. And so there's something about in the back of the baby's neck, which I think it's pronounced nuchal. They can measure it, and depending on how translucent it is or not, or how thick it is, or how thick the translucency is, they can see if there's a high possibility that your child has a form of trisomy, which is a chromosomal abnormality. And then from there, they can either do further screening, like an NIPT, non-invasive prenatal test, or, which is also, it's also a screening that's gonna give you a probability, it's a screening that's gonna give you a probability. And then based on that probability, you can decide whether you go to amniocentesis, where they're gonna pierce through your placenta and take out some amniotic fluid, or a CVS. Oh my God, something silly. But basically, both of those are invasive, which is why they call the NIPT non-invasive prenatal testing, although it really should be non-invasive prenatal screening, but whatever. And then the other one is a test. I opted not to have the NIPT. I'm not gonna take any action on it, and so because of my anxiety, I don't need to know that information. I'm not gonna terminate my pregnancy. I'm not gonna do a amniocentesis or a CVS, so I opted not to do the NIPT, but we did do the the Nuchal Translucency test, and I got to see the baby, which was fun. And everything came back fine. Oh, I meant to pull that up. I have it on my phone. I'll get that for you. It's in the portal. I might have printed it out, actually. I did. I have the printout, but first let me show you pictures of the baby. Some of these look a little spooky because you know that it's where there's fluid, where there's not fluid, but let's see if I can get it close enough. So there's the little hand. This is the head. She had to talk me through it because some of this looks like blob. This is the backside, a little leg. Yeah, it's definitely looking more human for the most part. Baby was very wiggly, very active. There's another one. This one looks a little scary because I can see where the eye sockets and the bones are. So she gave me quite a few because baby was very wiggly. That one, head here, body there. And then, yeah. So baby's definitely a lot bigger than 8 weeks. So much growing to do. And I will see the baby again at 18 weeks. So we did that, the Nuchal Translucency. Let me just read. They printed out a report, or they ran a report and gave it to me the next day. So encounter for antenatal screening of mother, supervision of pregnancy resulted from assisted reproductive technology, first trimester, ART, supervision of elderly, multi-gravida, unspecified. There's codes in here, there's billing codes in here, so that is what is coming up. Unspecified trimester, even though we know it's the first trimester. At any point, because I'm an elderly mom, that's a code for, it doesn't matter, first, second, or third trimester. So results, fetus 1 of 1, so we've confirmed there's only 1. Fetal growth appeared normal. Placental location fundal, it's at the top in the middle of my uterus, which is good. So far, so good. Because you worry about it covering the cervix, or if I had a placenta that's located in the back, it might be harder to hear the baby's heartbeat on the Doppler, so this is a good position. Amniotic fluid is normal. You want the amniotic fluid to be normal because baby is making that amniotic fluid, and that shows signs of at least one healthy kidney, so that's always good. Anatomy, PCI normal, visualized appearing sonographically normal. Uterus was visualized, both ovaries appeared normal. Crown rump length, so there's at this stage they're still measuring the baby from the top of their head, the crown, to the bottom of their little booty, their rump, and the baby was measuring 6.37 centimeters, which was 12 weeks, 4 days. The nuchal trans was 1.8 millimeters. Average gestational age, 12 weeks, 4 days, plus or minus 7 days. That was good. They looked at my cervix, singleton, blah, blah, blah. Patient was seen today for confirmation of pregnancy dating and nuchal translucency measurement. Patient is of advanced maternal age. This is an IVF pregnancy. Transabdominal sonography was performed and revealed a live singleton intrauterine gestation. Fetus measured appropriately for the expected gestational age. A normal heartbeat was also noted. Oh yeah, I got to hear the heartbeat, which was always good. This hospital, there's no filming allowed, so I couldn't even take like a snapshot of the screens. That's why she printed out so many of me too. No recording is allowed in there, which is fine. Fluid volume appeared normal for the gestational age. Fetus was normal in appearance. For early gestational age, nuchal translucency was measured and appeared normal. Uterus and both ovaries were visualized and appeared normal. No adnexal masses were noted. There was no free fluid in the cul-de-sac. Patients should be counseled regarding options for aneuploidy screening and diagnostic testing, which I had that conversation when I talked to the MFM. An ultrasound is recommended at 18 to 20 weeks to perform a fetal anatomic survey. Thank you for involving in the care of your patient. So all that came back normal, fine. Let's get to the MFM. I went in with a lot of questions. Oh my God. First of all, I liked that I got to talk to the doctor with all my clothes on first. So let me explain how they have it all set up. I went into the exam room for like samples. Let's just say that. I had to give a urine sample, get on the scale. 179 pounds, 179.4. I've gained almost 30 pounds. Right? 60, 70, no, 20, whatever that is. A lot. I've gained a lot. I had my blood drawn, all that fun stuff. Then after that, I go into the doctor's office with all my clothes on. We have a full conversation. Then I go back into the other room and disrobe, and we have this vaginal activity, which I don't know, that made me feel comfortable. And they specifically said the doctor likes to meet you for the first time with your clothes on. I had met her virtually in 2020 when we did my pre-conception consult. Is that it? PCC? Whatever. And so, but I had never met her in person. So I liked that because I had questions and we were talking, and it was like, you know, you're a little more dignified with your clothes on. You're in a vulnerable position when you don't have clothes on, even though it's a gown. It's like, I don't have on my gear, you know what I mean? My uniform. So that was good. I will say, when she did the exam though, she put her finger up my bum. She said it, that she was gonna do it. It didn't register fast enough, and then it was in. I was like, woo! And then she was like, okay, I'll give you a minute to get over the shock of it all. She was just like, it helps me feel your uterus better. That never happened in my pregnancy with Cheyenne. So I was like, oh my God. At any rate, oh, I skipped it. So before, I just wanted to get to that part to tell you guys. I skipped it. When we went in for the first part of it, when I was saying I left my clothes, and now I remember, they did the Doppler. The nurse did the Doppler after I did my urine sample, before they did the blood work. And actually, I don't think they did the blood work till after the doctor examined me. What else did they do in there? It was just the ultrasound and the urine sample. And in all of these, well, in the rooms I've been in so far, the ultrasound room and then this exam room, there's a bathroom, a private bathroom on each of them, which is nice. Like, I didn't have to worry about going down the hallway in a gown or whatever. That was nice. I just remember, like, when I had Cheyenne in Dr. Kaipa's office, the bathroom was on one side and you had to like meander through. So the first thing you would always do is go to the bathroom, and you didn't have a place to set your stuff down. So I don't know, I like that. I got into the room, I got to set all my stuff. It's winter, I got to take my coat, my scarf, take all that off, and then just go into the bathroom. It's the little things for me. So when the nurse was going to put the Doppler on to hear the heartbeat, she was super cautious and explaining everything to me. She was like, I'm gonna try. You're only 13 weeks, so it's still early to hear it on the Doppler. If I don't hear it right away, don't panic. And then if I don't hear it at all, the doctor will come in and try to hear it. So people have been asking me over and over, like, how's the baby? How's the baby? So immediately I'm like, oh my God, we're gonna find out how the baby is. Hopefully the baby is okay, right? So I can give this update to everybody who keeps asking me how the baby is. She found it straight away. Like, it was, she moved it a little. She was like, I heard it too. It was faint. She was like, hang on a second. And then she moved it, and then it was like nice and clear. I don't think I asked her the beats per minute, but it was easy for her to find. But I was appreciative that, especially with my anxiety, that she explained I may not find it right away. And this is a professional person doing it with the Doppler, so I'm not gonna be trying at home. Like, she was like, I may not hear it right away. Just give me a minute. And then if I can't find it, the doctor will come in and she'll look for it. So it just, I don't know, it just gave me a little hope, because there's that anxiety. I had that too right before, or right when the Nuchal Translucency scan, but then I realized she had it on a picture. It wasn't live, because there's a big screen. Like, there's a screen over here. It's totally different than the IVF clinic where we're both looking at the same screen. Like, she has her own screen, and then there's a big ass TV on the wall that has a screen. So when it first came up, that picture was frozen, so I didn't see any movement, and I think I started holding my breath. And then I think, so she was checking to make sure there was a heartbeat first, maybe, I don't know, before she made it live. It was only a couple of split seconds, but again, my head, it keeps going, how's the baby? How's the baby? So then it, you know, it all popped up, and I could see the baby was wiggling all over the place. So the same thing for, well, not that the baby was wiggling, but the same thing for the Doppler. Like, I heard it faintly, and I'm trying not to hold my breath, because then I think that's gonna make my heart beat harder, and then that's what we're gonna hear. So I'm trying to just tell myself, breathe, it's gonna be okay. And then, so we heard it faintly behind my heartbeat, and then she moved it, and it was just there, clear as day. So that was good. Doctor examined me, then we went back in, and I got to ask all of my questions. So I'll just share with you some of the stuff that she told me from response to my questions. She does not want me drinking 200 milligrams of caffeine a day. She said it needs to be 1 cup of coffee or 2 cups of cola, because the colas are like 46, so around 100 milligrams of caffeine. She didn't give me a number. I think she just was like, keep it to 1 or 2 Diet Cokes, basically, which I thought that was gonna be bad, but like today I did a cup of coffee at work. I didn't even finish that cup of coffee, so I think also the chalky taste on my tongue is like not making coffee taste as good as it used to. It all works out. Oh, they did my blood pressure. That was in the 95/68 was my blood pressure the next day. And they say your blood pressure lowers in pregnancy because your blood volume increases, but my blood pressure is honestly always low. She said if it gets to 145/95, that's a concern. When I did my pre-concept with her, preconception consultation, she told me to buy a blood pressure cuff, so I have that cuff. So she's saying to start out taking my blood pressure a few times a week at home, and then it'll eventually ramp up to every day. Weight gain, so oh yeah, they weighed me. Oh my God, I came in at 179.4. I started 3 days before my transfer. I was 161 pounds. I thought she was gonna say something to me, because when I was in with the nurses, like during getting my weight done ahead of time, one of the nurses whispered, what is it? She said, how much did you weigh before you got pregnant? I was like 161. I was like, I'm not doing good. And one of the other nurses, and they were from Wakanda forever, whispered in my ear, your doctor is a stickler for weight, so be careful. So I was like prepared to get a tongue lashing, but she was like, you know what? You have all this medication in you, the prednisone, your body fluid is increasing. She was like, let's not worry about it. Aim to get 1 pound, to gain 1 pound every other week going forward for now. And then she went on, I need 3 servings of calcium, even though I'm taking the $1,200, money, the 1,200 milligrams of calcium every day. She wants me to make sure I get 3 servings. So we talked about yogurt and milk, which I drink the macadamia nut milk. She said there's almond milk that is fortified with calcium. So I did order orange juice that has calcium in it. So I take that in the morning when I take my iron tablet and my prenatal. And I have yogurt. So the other one, there's other stuff that has calcium. I've been looking up like the chia seeds, broccoli. So I just have to be conscious of that. Only take Tylenol. She said I can have feta cheese as long as it's pasteurized. And she said most American feta is pasteurized, so don't worry about it. I can do my regular yoga up until 28 weeks, and then I can switch over to prenatal. She also talked about a recumbent bike. She wants me to do exercise to get my heart rate up to 140. I asked her about strengthening my abdominal muscles, because I just remember those babies were tired when I pushed out Cheyenne. So she said I can continue to do sit-ups and do whatever I need to strengthen my abs up until 28 weeks or until it doesn't feel good. She went on to say I will see her monthly, then it will go every 3 weeks, then every 2 weeks, then every week as we get closer to the due date. She said in all likelihood I will not go 40 weeks. It'll be somewhere before then. And I told her what the nephrologist had recommended. I mean, obviously he's not responsible for the delivery, but which he said 37 weeks. So she said thereabouts. It'll depend on how you're doing. There's like a sweet spot of where baby is okay outside versus inside. And so they try to maximize that. See, if I have something like preeclampsia or eclampsia hearts, it's safer for me for the baby to be on the outside, but we want the baby, I think, to be at least 24 weeks or longer. The longer the baby can stay inside, the better. After 36 weeks is considered full term, so baby can live outside of me no matter what. Well, in an ideal situation. Obviously, like 24 weeks, it's harder there's a lot of things going on with the baby. We kind of talked about that. Glucose, I'll have a glucose test at 24 to 28 weeks. She wants to have a fetal echocardiogram, so that is happening in January. I will do that the same day that I do my anatomy scan, but they couldn't book it at once. It's 2 different ultrasound techs. So in the morning, I'll have the fetal echo. In the afternoon, I will have the anatomy scan. I'll be 18 weeks. And then in the 3rd trimester, I will have to have another echocardiogram because there's much more blood volume and she wants to see how my heart is doing. I can travel. I told her I wanted to go to New Orleans and California. She said no travel 1 month prior to EDD. So my EDD is 6'3", so 5'3" is my cutoff for travel. So that was that with her. And then I got some goodies. All right, all done. I have this giant container that I have to collect urine in. She gave me this book, which I've been enjoying, by the American College of Obstetricians and Gynecologists. And when I graduated from the fertility clinic, they gave me a bunch of printouts from this organization. So I've been following those guidelines as well. But it goes through all the months of pregnancy. It's so interesting. Some of the books have the 1st trimester ending at 13 weeks and others have it ending at 14. I'm like, whatever. So yeah, it goes through all of the different things and then talks about baby's health and whether to circumcise or not, getting a car seat. It has like illustrations of exactly where the baby is in the mom. So I thought that was cool. And then I got maternity service, patient and visitor guide during your stay, which was cool. There's a bunch of stuff in here. I need to go through it. There's this countdown and there's samples in the back. I didn't see that. What did I do with the scissors, girls?
I'm all about that free stuff, y'all.
More of the breast storage bags and disposable nursing pads, and then a bunch of coupons. Oh, that's cute. 9 gift cards, $35, $50 gift card, 7 baby little fans, all that. You guys see that? There we go. That's cool. Mom Squad, free products, pictures. Okay, so fun stuff. And there's a welcome package. Welcome to the Mother Center. Sign up for tours. The tours are, they're in person. That's interesting because when I went on the website, it said they were all virtual. Tours will be offered on Tuesdays at 6 p.m. except for the 3rd week of the month when tours will be held on Saturday at 4. Maybe I'll do the Saturday at 4. That's easier than Tuesday. All tours are free of charge but require registration. Okay. Pediatric information. I have to have a pediatrician before I leave the hospital, or baby has to have a pediatrician before we leave the hospital. So I need to book a virtual tour. There's one like right up the street that hopefully it works out. Preparing to go home, checklist for discharge, all that fun stuff. You do not have to have a car seat to check out of a New York hospital unless you have a car. So I was thinking, which is why I wanted the doona, like that would be easiest, especially if I have a C-section, which I don't know if I'm having a C-section. I'm just trying to think through all of the scenarios. But I could just strap the baby to me and get on the subway and I don't have to worry about a car. You know what I mean? So that's what we have there. Oh, I got my pregnancy pillow tonight too. If you're watching my vlog channel on Vlogmas, you already saw that. I'm excited about that. So that was it with the MFM. I think I went through all the questions. Let me just double check if there was oh, I was gonna tell you about the nephrologist too. That was a thing. Let me just go, because that's what she told me. Let me go back to the questions I had for her. So Tylenol, she said I could take Flonase and Zyrtec. I have the pregnancy rhinitis. I don't know if you can hear it, the stuffy nose. She said the melatonin was good, tart cherry was good, magnesium, which I've been taking to help me sleep and to have regular bowel movements, and magnesium citrate is good. They actually, when women are going to deliver early, they actually give them magnesium. It helps the baby, helps mom. So the fact that I have some magnesium water right here that I've been drinking it only is helpful for me and baby. Also helps with your blood pressure, apparently. I guess that's part of the calming effect of it. I don't know. So I asked her about the delivery because it's a MFM practice group, like would she be delivering, and she said unless it's like a midnight emergency, she'll be delivering. So more than likely I'm gonna be scheduled, and I'll be on her schedule. If there's something that happens, God forbid, midnight, whatever MFM is on duty will deliver me at that point. I asked her about the doula. She said there's no restrictions on that, so I'm excited. I've got to pick out a doula. My goal is to have one locked by January 15th and interview them. I want to interview at least 2, just so like eeny, meeny, miny, mo. Interview them the last week of December because I'm off that week and I just want to be focused on that. I told her about the nephrologist, which is interesting because when I talked to him, he was like, well, I wasn't saying you had to have it at 37 weeks. I'm not the doctor, but I was like, no, I just told her that, you know, these were what your thoughts are around delivering at 37. So we talked about risk to going into labor. Naturally, no risk there unless obviously something weird comes back from the anatomy scan. It is my preference to have natural delivery. I had natural delivery with Cheyenne. Obviously it was a different situation because she was in distress, but I don't plan on having an epidural. I would like to just breathe through it. That worked for me before. Of course, I need a refresher on what that breathing technique is like, but I'm willing to do that, which is fine. I am not going to be a stickler. Like, I'm not going to put my life on the line or the baby's life on the line. If the doctor says you need a C-section or there's an emergency C-section situation, I'm absolutely doing that. It's just not my preference. I talked to her about my under boob rash. She was saying just put powder on there. It's getting much better now. It's like all healed up, where before the skin kept breaking. TMI, I know. It's just discolored, but she was also saying because of the amount of estrogen in the body, like that's when things like the pregnancy mass start to happen. You get the linea negra line down your stomach, which I don't have. Dark marks keep appearing, so it's gonna take a while for that under part, like for the color to return to normal, but it's all healed. Same thing for my underarms when they had gotten irritated. So there's like slight discoloration, especially for us melanated ladies. The pigment sticks around longer because of the increase in estrogen. I asked her, oh my God, because you guys asked me these questions before. So cosmetics, I have to discontinue my Latisse for my lashes, no Botox. She does not recommend the microneedling for my eyes. Is that what it's called? Micro, whatever it is, for my eyebrows, because it's actually breaking the skin. And she was saying with the added hormones, it might not heal the way that I would like for it to heal. And obviously any scar I get is likely to have hyperpigmentation. I already have that issue without pregnancy, but because of the increased estrogen, it's even more of a chance. Face microneedling, she said I could have that done lightly, not so deep that I would need numbing cream, and she recommended testing out a small area. Same with waxing. She said the skin may not react in the way that it did pre-pregnancy, so like to test it out in a small area, which I was thinking of a bikini wax, so I don't know if I want that irritated. I gotta figure out something because I'm not gonna be able to see to shave the whole time, and she said that there are no tests on the cream, so I'm gonna go back to waxing until it hurts so much that I can't, because I mean, how irritated could it be? I guess because I can get like an aloe mask put on afterwards. They offer that like as an additional service, so maybe we'll do waxing with the aloe mask. Like I can't be like a bush, and I can't imagine not having any sort of grooming there for the next, what do I have left, 6 months? Yeah, that would be weird. And then I asked her about gel nail polish. She said that was fine. So that was it. Those are my questions. Now let's get to the nephrologist. I love him. He's such a joy. If you follow me on Instagram, you already saw this. If you don't, it's simply.tanika. So this is the 24-hour urine collection test. I haven't had to do this since I had my kidney surgery. And the nephrologist thought it was funny. Like, because the MFM ordered this, he was like, he's on the fence about how effective these are, but she wanted a baseline. So because I have the one kidney, I'm already at higher risk for having protein in my urine, and then being pregnant via IVF, I'm also higher risk for having protein in my urine for preeclampsia. So there's all of that. Also, the baby's at higher risk for heart issues. I don't know if I said that. That's why there's a fetal echo. Babies conceived through IVF. I don't know if it's the freezing part. No, it can't be, because it's even true when you have like a fresh transfer. I don't know what it is, but whatever it is, they're more likely to have an issue. Notes from Dr. C. So he wants me to be very, very mindful of symptoms that I might have protein in my urine. So he said that was like foamy urine, like where it's super foamy and it stays after flushing. A lot of it, he said, will be dependent on my lifestyle. So make sure I stay hydrated, which I'm struggling to do, but I'm working on it every single day. Maintain a healthy diet. He said to lay on my left side for the best blood flow and order a pregnancy pillow, which it just came today. So I told him, I was like, oh, I thought I didn't have to really do that till second or third trimester. He said it supports the placenta having the good blood flow, so lay on your left side. He was like, even if you're watching TV, he was like, it's not worth the risk. Do not lay on your back, do not lay on your right side, lay on your left side.
So I was like, you ain't gotta tell me twice. Well, maybe you do, because I did have a question.
But you know what I mean. Oh, he was also saying, so 30 weeks is the least complicated time for the baby to live outside of mom. 36 weeks is full time. So he was like, our goal is to get to at least 30 weeks. And then anything else after that is golden. But if I'm good and baby's good, we're fine. When I get to 36 weeks, that's when I'm considered full term. Anytime after that is safe for delivery. Like if there's, say for example, if I have IUGR again, intrauterine growth restriction, like when Cheyenne was little, they probably take the baby out. But if I'm fine and baby's fine, we can continue with the pregnancy. Yes. That was it. That was so that was my first appointment. I don't think they'll all be that long, because I don't think we're gonna sit and chit chat for all of them. I will see her on the 4th, the same day that so I have like 3 separate appointments, and I might have to do that last one virtually with her. Maybe they can just, while I'm there, do my urine and blood, and then I'd pinball back to the office because my day is a little crazy. I will do the echo at like 8 o'clock, then I'll come back at 1:30 for the anatomy. Pray for me, you guys. Pray for the baby, that everything is okay. I think my biggest question mark is, does the baby have a cleft lip from the prednisone, or is anything else wrong? Because the nephrologist, of course, kidney doctors are gonna talk about kidney, was like, you want to make sure the baby has 2 kidneys at that point. So of course I came home and Googled it, and if they don't have 2 kidneys, if they don't have kidneys, that is not survivable. Another thing to worry about. As long as they have at least 1, they're good. I don't know why they wouldn't have kidneys, but I guess that happens. So we'll just keep us in your prayers. Oh, one more doctor. Oh my goodness. I am being weaned off of all my meds from the Reproductive Immunologist. Let me get that piece of paper. I am graduating from the Reproductive Immunologist. Probably by the end of December, I'll be fully off. I have lab work through 12/15, but let me just tell you how they're tapering me off, because a lot of you guys had questions about, am I still on the prednisone? Yes, but I'm being tapered off. Oh, and that reminds me. Let me do this, and then I'll tell you the comment that Dr. Lasala had about Dr. Thornton's immunology protocol. So start tapering prednisone. I started that last week by decreasing my dose to 20 milligrams a day, then 10 milligrams in the AM, and then for 1 week, the first one 20 milligrams for 1 week, then 10 milligrams for 1 week, then 1 week of the 5 milligrams. So tomorrow I go down to 10 milligrams in the AM, which I'm looking forward to. Hopefully that will help with my sleep. And then the week after that, I'll do half a tablet for 5 milligrams, and then I stop. The Love Knox, I'm gonna continue until I'm 16 weeks. So right now I'm 14. I have like a week and a half, and then I'll stop the Love Knox. I'm gonna continue the baby aspirin throughout my pregnancy at 81 milligrams. Dr. Chevalier, he doesn't pronounce it that way, but it's spelled that way. Dr. Chevalier said to talk to Dr. Lasala to see if when I go off the Love Knox, I should take 2 baby aspirin. That helps like prevent preeclampsia, blood clots, all that fun stuff. I do need to ask her that. I continue the Plaquenil until 24 weeks, 200 milligrams twice daily, and then I stop. It says for history of APAs, which will follow my APAs monthly. Continue the calcium 1200 milligrams daily, continue the omega-3 daily throughout pregnancy. Then we're gonna follow my APAs by having a blood test. Because they were previously positive from my baseline testing, they've come in normal, but I don't have to take any more testing for ReproSource, so I do not have to hike to Connecticut for any of that testing. testing. We'll just do LabCorp. We'll do that once a month. So I have one in December, January, February. You guys get it. And we'll figure out the Plaquenil from there. So hopefully we'll stop it at 24 weeks, but we'll continue to test just in case I need to go back on it. Let's just name it and claim it. We'll be stopping it at 24 weeks, and my anti-phospholipid antibodies will be not elevated. Right? They'll be negative. That's what they need to be, negative. So yeah. So the doctor was like, that's why I think she was giving me grace on my weight too, because she was like, you're on an extremely high level of prednisone, and she was like, I'm not gonna say anything bad against your reproductive immunologist because I'm sure you are grateful that you are pregnant and you would swear by it, but that's a really high dose, but you're weaning off of it, so we're just gonna move on. I don't know if it's a high dose or not. Like, I trust that Dr. Thornton looked at my blood work and decided that that's what it needed to be, and I have a sticky baby, so I can't be mad at it. She also was like, I don't know why they put you on the 30 milliliters of the Lovenox, it's usually 40, and so I said I started off on 40, then they tested me, it was too high in my system, and so they reduced it, and she was like, oh, okay. So all of that, you know, she was good with. It is what it is. She said I still need to get extra calcium. I don't think I mentioned, I can't remember now if I mentioned to her that I was doing the iron supplement, but I'll put it in my notes to talk to her next time. So yeah, that was it. That was like my MFM, nephrologist, graduated from reproductive immunology, got a clean bill of health from the Nuchal Translucency, got to see the baby, and now there's nothing until January. We'll wait. So if you don't have to ask me how the baby is doing, because I don't know. I don't know. I won't see the baby again until January. So hopefully baby is fine. Just pray that baby is fine, and then we don't have to talk about it. All right, if you have any questions, let me know down below. I'll talk to you later. Bye. Baby does do us all. Nurse who gave it to me put it in your fridge. Like, oh no sis, it's gonna go right out on the terrace. It'll be cold enough, especially in January. Hopefully we'll have some snow. It'll go right out on the terrace till the day before, and then I'll take it that morning. I'm not putting a whole thing of piss in my refrigerator.